Let's talk some more about fungal overgrowth. Now, the human body is filled with fungi in every orifice, crack, cranny, and surface. So you can find fungi of a variety of sorts in the mouth, the airways, the scalp, other parts of the skin, the gastrointestinal tract. Just about anywhere you look, even internal organs have been found to contain various species of fungi, such as Candida albicans or aspergillosis and others. But when do fungi actually pose a risk to you, that threaten you with a disease? Well, we've known for a long, long time that there are very serious fungal infections. Most commonly Candida albicans, but also many others, Candida glabrata, aspergillosis, and many, many others. So if you have an immunocompromised situation, like AIDS, or you have a very low white cell count from chemotherapy or from cancer, you're very prone to fungal infections. Also, people with prostheses in their body, like an artificial heart valve or an artificial hip or knee, they can be prone to fungal infections. And when that happens, it's a very serious problem. You can get very ill. You're treated with very potent and dangerous antifungal agents like amphotericin B. And the prosthesis often has to be removed, which is very difficult on people. And there's about a 30% mortality, death rate, when you have a serious fungal infection. I'm not talking about those kinds of fungal infections. I'm talking about much more subtle kinds of fungal, not to minimize what you can experience with these fungal infections, but they're not life-threatening. They don't kill you within days like these serious infections do. Instead, these lesser fungal infections lead to such things as candidal vaginitis, or fungal infections of the skin, itchy eczematous-like skin infections, or overgrowth of fungi in the gastrointestinal tract, both in the colon as well as the upper GI tract, and other areas of the body, like the throat and the esophagus. Now, when do we know these become problems? Well, we know it's a problem in the mouth and esophagus when you have white plaques and very painful swallowing and chewing, etc. But how about in the gastrointestinal tract? When do we know that fungi have over-proliferated in the gastrointestinal tract? Well, this has been a tricky question. So for decades, mainstream healthcare practitioners have poo-pooed the whole thing and said there's no such thing. But more recent science has emerged suggesting, yes, this is probably a real problem, because people who have serious diseases, like ulcerative colitis or Crohn's disease, or celiac disease, tend to have much more higher fungal counts in their gastrointestinal tracts. People with SIBO, small intestinal bacterial overgrowth, also often have small intestinal fungal overgrowth. At least a third of people with SIBO also have fungal overgrowth, suggesting that a disruption of bowel flora may permit proliferation of fungal overgrowth. So when do you know you have fungal overgrowth? Well, if you have SIBO, think about it real seriously. Give serious thought to that. If you have such conditions as persistent skin infections or persistent autoimmune conditions, even if you did everything right in my Wheat Belly Total Health and Undoctored programs, that has eliminated the gliadin protein that initiates autoimmune diseases, if you've corrected vitamin D, because deficiency of D permits the emergence of autoimmune diseases, if you've done such things as also introduce omega-3 fatty acids, which has a soft effect in reducing autoimmunity, or other persistent health conditions, give some thought to whether you might have intestinal fungal overgrowth that could also be seeding other parts of the body, because skin fungal infections, vaginal fungal infections, and other areas often accompany the fungal overgrowth, because I believe the fungal overgrowth in the intestines acts as a repository or a seeding process for other parts of the body. If you think you have it, you want to confirm whether you have it or not. You can do that with a blood test for an antibody level, typically against Candida albicans, the most common fungi of all in the human body. You can also obtain a stool specimen, such as the Genova GI effects test, and there's many others too, to identify whether you have fungi in your stool. What's not clear, though, is how many it requires to establish a diagnosis. Some would say 10,000 fungi per milliliter, some say 100,000, some say less. So there's not broad agreement what constitutes a fungal overgrowth. So you have to put the entire picture together and decide, do I have fungal overgrowth or not? Do I have an unexplained skin infection and I treated my SIBO a month ago, yet I have persistent problems, maybe even some persistent irritable bowel syndrome symptoms? that would be a situation that would be highly suggestive of fungal overgrowth, and maybe you accept a lower count in the stool and embark on a treatment program. Now, how do you treat it? Now, that's another long conversation, but the good news in this is that there are many agents to choose from, many of which are natural and benign, and you can introduce yourself, like berberine, or oil of oregano, or other food-sourced essential oils, clove and cinnamon, and many other choices, turmeric, curcumin. Now, how you combine these, how long you do it, is a much more extended conversation. If this applies to you, consider joining my Undoctored Inner Circle. It's a membership website. And by the way, the membership dues you pay help to grow this movement of being freed from the tyranny of the healthcare system. So it helps us develop our programs, broadcast our messages, also introduce new ideas into the Undoctored menu of practices. But the deep dive is in the Undoctored Inner Circle. For some other conversations, I have more conversations posted about this on my Undoctored blog. Subscribe to this YouTube channel. I'm going to be releasing more conversations about this and related topics. And of course, the many thousands of conversations on my Wheat Belly blog and my Wheat Belly social media. The whole point here is to help you identify whether you have some kind of a situation that you can address on your own, because your doctor probably won't have any knowledge whatsoever about fungal overgrowth, but you can be educated and take steps to feel better.